You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Ivan, please go ahead and help us get started.
Hey, I'm Ivan Zach. I'm excited to introduce Suvi Irvine. Suvi is the Clinical Development Manager at Blue River PetCare. With deep roots in veterinary medicine, growing up in a veterinary family, she has held many roles, including Senior Regional Manager for Blue River PetCare and Hospital Administrator for Napa Small Animal Hospital. Her hands on experience in various practice settings give her a well rounded understanding of the field. Suvi earned her doctorate in political sciences from Johns Hopkins University and returned home 10 years ago to run her family veterinary business. After selling it to Blue River Pet Care 6 years ago, she remained in the industry focusing on leadership and management to improve patient care and support staff. Passionate about innovation, Suvi advocates for the use of AI tools and technology in veterinary practices. She is dedicated to creating a positive work culture, enhancing access to care, and supporting the well being of veterinary teams and patients. Suvi, welcome to the show. Thank you for finding the time.
Thank you so much for having me. It's an honor to be on the show with you.
So Blue River grew quite rapidly. They're up to a number of hospitals now. What was your experience in joining them 6 years ago, and how that transition of the company and the growth happened, and how did you find your role within these hospitals?
Well, that's a good question. And I think it's probably clear, given that I'm still with the company, that my experience has been very positive. My family found Blue River when we were looking to transition our hospital to other ownership. My father was at the point of retiring, and we needed to find an exit strategy. And we had always sworn that we would sell our hospital to a corporation over our dead bodies, but suddenly that was no longer an option. So we really had to look at the options out there. And Blue River was a great fit because we have a very democratic approach to hospital management. We let each hospital maintain its own individual identity and establish their own protocols and practices. And so we chose Blue River because we assumed it would allow our hospital to continue to be itself. And then the company has continued to support me in my own personal growth with wanting to support hospitals and establishing really positive veterinary cultures so that they can provide access to the most pets possible.
So that's a really great topic to unpack because I'm involved in the growth right now of the hospitals, and culture is very important and very deliberate thing that we do. In your experience, mixing the different cultures, so as individual hospitals, I think it's very important to maintain the local culture. But when you're assembling it into the united organization, what does Blue River do to maintain the overarching corporate culture that integrates all of these different cultures within it?
I was actually listening to a program on a different topic yesterday where someone was talking about the importance of moving at the speed of trust. And that really struck me as something kind of fundamental to what we do at Blue River, as well as very in line with what fear-free is. And we have a lot of fear-free practices at Blue River. But I think what we do as a company is that we really want to hear what our practices need, and then we work with them in order to establish those needs, get them what it is that they desire and what their hospitals need to be successful. So we really do work with trusting relationships with our practices. And I think that that's key to leadership in the practice as well as the organization.
Yeah, that makes a ton of sense. So, one of the topics when we were kind of preparing for the show, and just chatting in the green room before the show started, was your passion about AI and how you're bringing AI to Blue River. And let's talk about that a little bit. So, you've seen a lot of challenges in the sphere of veterinary medicine. You've been in it for quite a while. It seems like you grew up in it. What do you think the opportunities on the horizon for the profession are when it comes to artificial intelligence?
I think that they are enormous. And I would say that it's also rather amusing to me and others that I have become an advocate for AI because I have not been the most tech forward person by any means in my own personal or professional life. Friends and family have kind of looked at me like I fell down and hit my head when I first told them, hey, ChatGPT is this new thing. And wow, I went to a conference and I saw this product, that it's an AI transcription product. It happens to be called ScribeNote. And I have worked with ScribeNote and HappyDoc now quite a bit, but I was just blown away away at how good this product was at summarizing notes so quickly. And in my own personal life, again, had started using ChatGPT, which was introduced to me by my late director of clinical development, Jordan Van Drummond, who passed away last year, very sadly for our whole team. But she sort of saw in me my interest in AI and really encouraged me to explore that. And again, I think that's a lovely thing about Blue River is that we are open to exploring these kinds of options for hospitals without in any way expecting hospitals to adopt them.
So, how do you find veterinary teams react to it? I've seen, the adoption of this Scribe type of software, such as Talkatoo and Scribe Note and others, been quite rampant, and I found that veterinarians are adopting to that much faster than anything I've seen ever before. It seems like it struck the right accord and the pain point in the workflow. Are there any other tools that are more important that you think to the veterinarians on the floor, or and what other applications? I know that you mentioned ChatGPT. So, for what main applications do you see people using it? And I guess that's probably a lot of questions. So I'll just pause there.
Yeah, I will say one area that I'm really curious about using it is honestly in starting to use virtual receptionists. And that's partially because I've been a receptionist. I have spent a lot of years in that seat, whether as the receptionist or as a practice manager helping out. And there are so many aspects of that job when it comes to scheduling and when it comes to just talking through things with clients, discussing refills that I think the chatbots are getting good enough to be able to handle very well. They're not perfect. And I know that there's a whole concern about AI that we have to address, certainly. But I think that there's going to come a point where that's a job that is not always that desirable for that many people. It's a job we train and and retrain a lot. And I think that there's going to be room to have support for a human person or two through a chatbot. So not replacing completely the need for a human body in the hospital, but really helping to support the ones that we have.
Yeah, it's really incredible. I was chatting with a friend of ours, Ivan, in Las Vegas last week, Stanty, which you remember, and she turned me onto a podcast, which just literally has blown my mind, and I'll recommend it to our entire audience. And it totally makes me think, Suvi, of your example of the virtual receptionist. And there is a couple of companies, Ava's one that's doing this in the veterinary domain now. It's still early days, but I think it's very interesting. And the podcast is called Shell Game. And on this podcast, the guy hooks up his voice, he clones his voice and hooks it up to an LLM, and then he has it answer customer service calls, and then he has it make calls. And as the episodes go on, he has this chatbot that's hooked up to ChatGPT, talk to his wife, attend therapy that he pays for as the LLM. And it's a great listen. So I think it really demonstrates where the world that we're kind of very actively involved in could go. And it's not without its risk. You know, he has a chatbot talk to a chatbot and they get lost in conversation and just repeat what everybody is saying for a very long time. But Suvi, what do you think that end game looks like? You know, it's everybody gets annoyed if they can sense that it's a robot that they're talking to. But how do you think that's into veterinary medicine? What do you see that vision look like?
Well, I think first of all, people are going to become more familiar with the experience of talking to chatbots. So that is going to come, like whether it's veterinary medicine or elsewhere. But I also think that again, I look at it from the perspective of having been a receptionist and having sat alongside some other really, really strong receptionists. But that it's a very challenging job, and frankly, it's a hard one for us to pay very well in. I think that's another thing we always have to think about in veterinary medicine. So the career potential for growth in that job has never been great. I think it would be better suited to, again, really prioritize the very strong communicators who need to have that interactive role with the client when they come in, have them have support from chatbots, along the side. And I think that our hospitals in the future are going to be in a model like that. I do think that's what we're going to end up seeing. Whether that's going to be in 5 years or 10 or 15 depends on how quickly we're willing to change.
This episode is sponsored by Zomedica and the Vet Guardian Monitor. Scott, continuing our discussion, what kind of feedback have you received from vets that are using Vet Guardian's Monitor?
We've been getting fantastic feedback. Vets appreciate the ease of use and the fact that they can monitor patients without intrusive leads or wearables. The real-time alerts and remote access have streamlined their workflow and significantly improved patient comfort.
That's pretty impressive, Scott. What's one feature that users find especially beneficial?
The zero touch technology really stands out. It allows for capturing vital signs from up to 5 feet away, which reduces stress for the animals and saves valuable time for the vets.
That's absolutely crucial in a busy practice. Thanks for sharing the insight, Scott.
So, are we talking about the virtual receptionists that are just not in the hospital or completely automated robotic chat GPT receptionists?
Talking the automated, the automated one. And maybe part of that comes from my experience as a practice manager and regional manager and having to train over and over again and having the role not stick. And I mean, sometimes that has to do with training issues we need to work on in hospitals. And there's other factors we have to think about why we don't always have as many receptionists working out in our practices, but that does tend to be a role that has a shorter life cycle than others in the hospital. And I think you could find somebody or some people to fill that role with support from chatbots that would be very strong. I mean, as you said, talking about this other show you were listening to, it's amazing what the chatbots can do, which isn't to say that they don't make mistakes also.
Yeah, but they can be given parameters and guardrails. And I mean, listening to this podcast, Go to Therapy and talk to a paid therapist was super eye-opening. And I mean, the rate that all of this stuff is changing is amazing, but the latency is always the issue, right? It's like if you're having a conversation and there's a 2 second delay before you get the response, and then you know that you're talking to a chatbot, it makes you frustrated. And so it's going to be about cutting down that latency and making sure those conversations seem normal. But I think you're right. I think it's a redundant job that maybe they could be adding more value to the practice. And maybe it's not a full replacement, but maybe they can take a bit of that lifting off initially. And then we go to somewhere that's even more incredible down the road. I don't think you're wrong. I think it's going to be a staged kind of journey.
Yeah, I don't want to imply that this is like really replacing jobs. I just don't feel that there's enough people actually who want the jobs that sometimes we need people to do in the hospitals. And that means that we can focus the rest of the work for the people who want to be there on other things that they can do, right?
Yeah,
That's
higher value work.
right.
Yeah, for sure. No, that makes sense.
So that's interesting as you guys talking about it. I'm just thinking that, Sean, what you mentioned, the annoyance with understanding that there's a robot there. I don't think I would be annoyed if I do know that there's a robot. Maybe I'm just a sad guy, but I do talk to ChatGPT as I drive. If I'm brainstorming about something, maybe I need friends. But in reality, if I know that this is the chatbot, but with loaded amount of information, sometimes it's better to understand someone with, than someone with a thick accent like maybe mine, and just really get to the point of the knowledge base that has all the answers that I need. So I think that this is an interesting provocation that maybe if it is clearly identified that I'm talking to the bot, don't try to fake it that it's not a bot, but I know that this is loaded with the knowledge. So I think there's something to it.
Yeah, it's almost like you could split the volume, right? You could say, sorry, there's no one available to take your call. Would you like to talk to our virtual bot? And then if people go there and they have an intelligent conversation that gets them the information or books the appointment that they want, then, that might handle half the missed call volume, which I think is exactly what Suvi is getting at. This is the direction that we're driving because there's not enough people to do these jobs, and it's not like there's more of them coming.
Right. And I think that that's kind of the model that these platforms like Ava you mentioned. There's one Dodo also, and I've talked to some of them. I don't know. I don't think we have anyone at Blue River using one of these platforms yet, though that might happen. But I do think this is where things are going. So I'm hoping, that we'll get to see one in action one of these days.
What other things besides, we've got the medical records, we've got somebody answering the phone. What other uses for AI do you see across your group of practices? Put your Imagineering hat on.
Well, that is a good question. And I wish I really had an answer. I will say that I actually get asked questions by like the ScribeNote team or the Happy Doc team, or I've talked to Sebastian at Digitail and, have sort of said, what do you guys need? What are your teams telling you we need? And I haven't come up with something yet. And I also think that we have to remember it's important not to try to find an AI solution to a problem, right? Like we're not trying to just create a platform and then find a way to make it work in the hospital. We have to like really find something that it speaks to us. This is something that we could automate somehow. But I think we're going to see more opportunities as we just learn as creativity does its thing and we see more ways that people are applying this stuff. I have talked to some folks who have said eventually they imagine, doctors having like a little microphone that they speak into and basically can command all kinds of machines like an Alexa or Siri, kind of thing. But can you imagine how complicated that could be in a hospital with multiple doctors? What would that look like? How would it really work? Right. I don't want to try to think about, I haven't come up with or a new thing, basically, is what I'm, I guess, getting at with you here.
Interesting. It's almost like having a smart home, but having a smart hospital, and then all the things are just turning on and working for you. It'd be very interesting having that integrative experience. You mentioned in the prep notes that I was reading through that looking at the adaptation of the veterinary industry during the COVID, how they adapted to the environment. Do you really think that veterinarians jumped on bandwagon of the adopting to telemedicine and other things, or do you think that they stalled a little bit and adopted more to the curbside and still worked around the technology?
I think that we learned that we can adapt like immediately when we have to, but I don't think that this pushed us to use technology as much as it could have potentially, right? But I think the timing also is a little interesting in that the pandemic, that frankly, I know AI came before ChatGPT, I know that. But what ChatGPT did was put in a lot of people's faces and make a name for AI that people were not paying attention to before in quite such a strong sense. And so I think that like the last 2 years have made it easier to push some of this stuff, though I still have found it extremely challenging at times. I thought when I first discovered an AI transcription tool that everyone was going to beat down the doors for it. And I think it was about 3 weeks before one doctor called me and was like, if you ever take this away, I am quitting. But it took a few weeks, and then it's taken quite a bit of talking with teams to get them to do it. But we are seeing that now. I am seeing a lot more interest.
Yeah, and at this time and age, it's we talked a lot about different AI tools, and we talked about radiology and how the X-rays are interpreted. And I'm looking and I truly believe that if you're not using these tools, it doesn't matter how fast you type and how thorough your notes are, you just can't beat it. And I was on the late shift last night until midnight, and I saw not that many patients, but I put it off on the very end of my shift, and in 20 minutes, I finished like I don't know, 9, 10 records, just boom, boom. When I was done immediately and went home. There's nothing that can replace that experience. This is not going away. So I think in the competition of even being a veterinarian, it's like in the past we used to write, in our resumes that we, fluent with the Microsoft Word and Excel. Like I think that this should be a part of it because if you're a vet that's not using it or resisting to use it, you're going to see 10 patients less per day. Your productivity just less no matter how fast you are. So, but yeah, I'm definitely on that bandwagon already. We are out of time, as usually we are. This is a very exciting conversation, but every episode we get to this point. So, Sui, we ask two questions at the end of the show. The first one is there a book, TED Talk, video, YouTube, something that inspired you recently that you would like to share with our guests?
Yes, and I'm going to sound like a super nerd when I say this, because I have started listening to the World Science Festival put on by Brian Greene is a festival that has basically a lot of public intellectual level talks, and there's one on it's on AI and whether it's a gimmick or not, and it's a really interesting interview on the notion of what AI is doing to humanity, basically, really looking at it from the perspective of the arts. Actress Justine Bateman is on it, and she is very strongly against what AI and chat GPT type things can do, whereas there's also a proponent of it. So it's a really interesting discussion. And in general, I just think that it's important to keep learning in this world. And there's really, really great subjects on things that I don't typically think about in my day to day that I learn from in those episodes.
I think it makes sense. We'll link it in the show notes. It's AI Creativity, Genius or Gimmick. Sounds like a great title. Sounds like something worth watching. The next question, or the last question we have for you, Suvi, is a guest recommendation, some other innovator that you think we should have on the show.
Dr. Danny Rabwin. I started working with her. She's going to be doing some webinars for Blue River next year, and she does a lot on mentorship with Ready Vet Go.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.